the first point I'd like to make is, with Dr. Gerson, is just that I think everybody really appreciated that cartoon around how to deal when there are infections, the shoot one. Just want to put that out there. I felt the laughter even though I didn't hear it. So the first question is, Dr. Gerson, this is from Andries Frey. Dr. Gerson, is there any faster TB test on the horizon for cattle, like in humans? Because the current bovine TB test takes 3 days for a diagnosis.
Yes, that's an excellent question. It almost feel like I paid him to ask it, but I didn't, I promise. So the main aim of our group is, we're actually based at the human medical faculty, and one of the biggest aims of our group is to repurpose and develop tests based on what's available for human TB patients. So a lot of my research in the last 2 years was actually around improvising the human gene expert MTB RIF diagnostic assay that's routinely used in different areas, rural and suburban, to try and improve at least the detection of the presence of Mycobacteria tuberculosis complex members. So we're fighting hard to try and get those provisionally approved by the OIE and recognized by DAF, so that we can start increasing our research around it, really, to show efficacy, and also enhancing, taking the research further and what's available. Because like you say, currently we're 20 to 40 years behind human researchers in the sense of diagnostics.
Thank you so much. There is another question from Gordon Branston. He said, thank you for a very interesting topic. Is there an added threat with the COVID-19 pandemic occurring in wildlife and the ongoing TB infection nexus in animals affected with TB, and the threat of COVID-19 in wildlife animals? Gosh, I hope I got the spaces right there. Has there been research being carried out in this area of interest and potential impact? Over to you.
So it's early days when it comes to that. We're actually thinking about, or we're not thinking about, but we've been screening banked samples with the technology we have for COVID-19 that's available for humans. So obviously, test needs to be tailored specifically for the species that you use it in. So to the technology we have and the samples we have banked, we've started looking into this. But there's no answer for that question. It's way too early days to really mention anything about the impact it may have. These are things that we wish we had the answer for, much like the market when it comes to Bitcoin. But I guess we'll only have to see and do our best and see what we can do.
Thank you. I'm just having a look here. There's a comment from Michelle Miller around this. COVID has been diagnosed in captive wildlife in a number of zoos, and for instance, in the mink industry in multiple countries. I suppose that was a further comment around that. I have a question as well. This is with regards to a point you made on your slide. I realize that it's operational, but I'm very interested in this notion of collaboration when you have these kind of multi-sectorial, when collaboration needs to happen. The question is, you spoke about you need government to work with research groups and not against them. What do you mean by how governments can research, how they can do this better in terms of working with research groups? And what do you mean by how they've worked against you? Over to you.
So this is a very sensitive topic. And as a scientist, I think I would tread carefully, because I'm not a veterinarian and I'm also not a medical doctor. But it's almost like I want to refer the question directly to Professor Wanda Markotter, but she didn't touch on it. She actually hit the nail on the head when it comes to data that's stuck with researchers that may be used to prevent the next pandemic or epidemic, but it's not reaching the people that makes those decisions. And that's where we need improvement. We need that pipeline or that area to be improved so that the research and the information reaches the stakeholders and also the people of importance. I'm only the lab rat, but it's even evident to me that that's where the massive, what do you call it, tunneling is happening, or the bottleneck effect in research in South Africa at the moment.
Thank you. I wonder if Dr. Madra wants to further respond to that.
I actually had my hand up earlier for something else, but maybe let me address this one first. I think most researchers have Dallard and my colleagues in epidemiology at the top of the black books, if anybody has a black book. Unfortunately, we have had to introduce and tighten our controls around research in the last years. It started off being a very painful exercise for everybody involved, including ourselves, because we were still learning what to look out for. Whenever you hear somebody saying Section 20, that refers to Section 20 of the Animal Diseases Act, that indicates that any research conducted in the country needs to be, well, research involving animals or animal pathogens needs to be done under permission by the director in terms of Section 20. And what we look at before that permission is given is the risk that that research poses to the country. And unfortunately, researchers sometimes fail to understand our madness when it comes to that. And I apologize for the frustration. It's unfortunately a very necessary devil for the country that we have to go through. Going to the other comments that I wanted to make, thanks for the last presentation. I actually like that slide, shoot, because I think we do that very well as vets. And in the department, we were actually very sympathetic to our medical counterparts when COVID started, because from a veterinary perspective, we would have actually dealt with it fairly quickly by culling. We cull. Who is infected, snotty nose, vomiting, cull. So we would have gotten rid of this. But unfortunately, with people, you don't have that luxury. TB diagnosis question. The other frustration, and we welcome all the research and development to looking into alternative diagnostics. TB, the current TB testing is very subjective, if I could put it like that, because it depends on the tester, not that much as to how or presence or absence of a disease. If a Mpo goes and tests on a farm and she's not experienced, the current test leaves much room for misdiagnosis. So, Wynand, if your team is ready with that work, please let's chat some more on the site so that we can see what is out there, what's available, and what can be approved by the director as one of the diagnostic tools for tuberculosis. So that's it from me. Thanks.
Can I just make a small comment? So
Sure.
in terms of technology available, TB testing in humans started decades ago using purified protein derivatives in a Mantox test as a skin test. So injecting the patient and waiting 72 hours to observe inflammatory response on the hand. So since then, so that technology stuck around, and till today, that's used in animals. But after that, the human industry actually started bringing out different technologies like the quantiferon TB gold assay, which is a blood-based test using peptides specifically for Mycobacterium tuberculosis and Mycobacterium bovis. So they're increasing the specificity of testing, and I think that was what just was referred to. But to get that test to a certain extent where it can be implemented in our country has been a challenge. So I'll gladly sit and discuss our data in the last 20 years about that test to try and further it in the country.
Thank you. I just want to go back to Dr. Maja. By the way, apologies for my laughter. I didn't realize my microphone was on. You just said something very funny. I want to just go back to the first questions with regards to how Dr. Wynand responded, as well as the questions that were brought up by Prof. Makota. They seem to not be talking about what research needs to be done in terms of creating a database. It seems the question is, why is there not a general database with the results so that you don't have to search for the results in a whole lot of different areas? Am I correct?
That is correct.
And I think the question was around that rather than how, and I'm speaking to Dr. Maja now, the question is rather around, can a database be developed? Over to you, Dr. Maja.
Yes, there is no central database that has all of that information. And I'm not sure from our side if we have the required capacity to even come up with that. So once again, we welcome any suggestions. It would definitely have to also go through a public consultation, because as you can imagine, some people would not want their information to be captured in a central database. But that is actually a very good and important aspect that the colleagues are bringing. We need to know what is going on out there, even if you are not going to respond to it immediately, but you need to flag a certain reports and certain incidences, so that if 2 weeks down the line something else crops up, you can remember what happened recently. So it's most welcome. Any suggestion, please, colleagues, let's table that and see how best we can coordinate all of this. Thanks. I hope I've answered.
Yes, thank you. There is a question in the Q&A from an anonymous attendee. Question for Dr. Maja. With the current biosecurity associated with research laboratories, isn't the risk of research causing a disease outbreak very low? Can we use the example of other countries? Over to you, Dr. Maja.
Actually not. If you are sitting in Delpen, where my office is, and you see all of these audit reports that the laboratory team churns out after these audits, you will realize that 95%, and I'm sorry if I'm insulting some of the researchers, but 95% of research and researchers have no understanding and appreciation of biosecurity and the risk that they are putting to the country. So it's a necessary devil, but if there's other easier ways of auditing and evaluating the biosecurity measures at different research laboratories, by all means, because we have 3 people currently having to audit all of those, and it's impossible for us to get to all laboratories. But the majority of people honestly do not appreciate or have a comprehension of biosecurity. It's amazing how we take it for granted that everybody should be understanding, but how little people do actually understand.
Thank you so much, especially with speaking in such a straightforward manner. It's much appreciated. I don't know if anyone wants to respond to that, but before they respond, you've noted a number of times about people providing suggestions or tabling. Is there a specific, are you this person that they should be contacting, or is there a specific email address, or how can they contact you?
We have a central email that people can use. It's epidemiology@dallard. I should say that slowly. Epidemiology, as you say it, as you spell it normally, at Dallard being Department, Agriculture, Land Reform, Rural Development, .gov for government.za. It is meant or womened by a number of colleagues, and your email will definitely not go missing if you send it to that address.
Excellent. I'm not sure. Let me have a look at. There are more. Now there are loads of questions. Thank you for responding to the biodiversity one. Anonymous attendee says, oh, he's responding to, or she's responding to your question around biosecurity. How can animal owners and vets send samples around the country without the same requirements as researchers? Over to you, Doctor.
Sure. I'm not sure I understand that question, but if I could remind colleagues and Anonymous, remember the it was after the 2000 UK outbreak of foot and mouth disease and how that happened. That was a virus that escaped from the lab in the whole of the United Kingdom. People that we think are knowledgeable, but the virus still managed to escape. So my simplest response would be, a laboratory is a higher risk because of the activities that take place in a laboratory. You handle much more, many more samples, much more viral load or bacterial load, and it stands a chance of escaping more readily than just a sample that's being sent to a lab for Babesia testing, for example, for dogs. I don't know if I've answered Anonymous, but feel free to do a follow-up question if I didn't answer you well.
Thank you very much. I'm going to, in the meantime, I'm going to ask the question from Gordon Branston. In human populations, the strategy of antibiotic resistance is high on the agenda and has become the silent pandemic of antibiotic resistance. Is the use of antibiotics in animals a similar threat in terms of preventing the spread of multi-species disease? And if so, what is the future strategy? I'm not sure if this is directly to, it must be to you, Dr. Maja.
Okay, I was not listening carefully because my name was not mentioned at the beginning, but yes, antimicrobic resistance has become one of the global discussions and top of the discussion documents or discussion groups that we have. Animal use of antimicrobials in animals has become one of those that we have also flagged, and purely because most of these animals are reared for human consumption. So if you end up with resistance in your food-producing animals, it will definitely be passed on to people. But still, having said that, I'm not sure if I'm the only one that when I go to the doctor with a sore throat, that could very likely be an allergic reaction or even a viral infection, I get given antibiotics. So that's problem number one. Now, problem number two is the minute I feel a little better, then I stop taking my antibiotics. And should that have been a bacterial infection, we are perpetuating resistance as well in that way. So the global and local discussions on resistance needs to be tightened. We need to actually do more surveillance and see first where our problems emanate from and how to best harness or arrest that, and how best to prevent further mutations and resistances from forming. So that would be my response. Thank you.
Thank you so much. I'm not sure, Dr. Goosen, is there something you'd like to add to that? Does that fall within your field?
I wanted to speak to the regulation, the Section 20s that's implemented by DELRAD. It's a system that works. It definitely works, and I think it's useful, and I think it must continue to be implemented, and people need to obey by it. I think the major area that we should work together on is output management and data sharing, of which human researchers at medical faculties have specific teams just for that, to improve knowledge transfer amongst clinicians. And I think we can really exploit those teams from an animal side to enhance surveillance of specific diseases in South Africa. Thank you.